Welcome to the studio. The topic today, the herniated lumbar disc. Thank you, Michelle, for being here. You have been going through this experience. Herniated discs are quite often, it's very common, one of the most common spine problem, and they have a natural tendency to heal without surgery. And we want to see exactly when do we need surgery, when not, what are the criteria, and how can we do some specific treatment and find out the underlying movement patterns that led to the problem. So it's always an important part to find out the origin, the reason, and then to integrate those in the therapy. So Michelle, please tell, how did it start?
So actually it began for me quite suddenly. I woke up one morning, I had quite a sharp, hot, I would say, pain radiating down my right leg. I had some numbness in the foot and coming up the leg, and I noticed that, if I was on all fours, I had a little bit of relief from this pain. So I went to a doctor, I went to a couple of osteopaths to try and find out what was going on. Unfortunately, none were able to diagnose it, and through a recommendation, I ended up coming to you, and you were quickly able to diagnose the herniated disc and also ask for an MRI so that we had more detail on what it looked like and could choose an appropriate treatment path.
So in your case, Michelle, you had the sharp pain along a defined line, you had the numbness, and you had also a slight paralysis of the big toe, and you had pain, coughing, sneezing. So they were all the classical symptoms of a herniated disc. In your case, it was easy, and the MRI, was actually, showing very clearly the herniation. Now let's have a look, because that was the first thing we did when we met each other. So to have a close look how the herniation actually works. What kind of spine movement prevents or increases the herniation, and which kind of movement helps you to prevent further herniation. Yeah. So we see here, the compression in the front leads to the herniation. Yeah, it's self-explanatory. So each time you compress the front part of the disc, it increases the compression. So this has major implication for everyday life. You needed to take some rest for a few weeks, because healing the disc, they have no blood vessels. So it's not like a muscle or a bone. It takes 2 to 3, sometimes 4 to 6 months to heal. And the first step is you need some rest. And when you get up, go to the toilet, when you eat something or so, to avoid ventral compression. How did you manage this apply this biomechanical principle in your everyday life?
Well, I got some really good guidance there from you and also the physiotherapist. Obviously, avoiding forward folding. So if I had to pick something up off from the floor, either asking someone to do that, or I bought one of these claws so that I could pick things up without leaning forward. As you mentioned, I was lying down for, I would say, maybe 4 weeks most of the time. I was able to continue working because of the nature of my work. So I had a small desk I could put on top of me while I was lying down and continue working. I even ran workshops like that.
So you have been working full time?
Yes.
Yeah.
I don't know if it was full time, because I did need a little bit more time to rest and regenerate, but I was able to continue everything that was important.
Yeah. So, and then you slowly recovered, and we could go to this next step to bring you back to normal life, to start some movement. So, and we want to have a quick look at one exercise shown by Christine, how once you get up again, you can start moving your pelvis without risking or without having any forward bending. So it's still safe, for the disc. So here you can see it's a very easy exercise. You see Christine, her hand in pelvis, and she just steps on the spot. and the pelvis makes a slight movement, lateral flexion, left, right. And you can see here in the close-up, that we have create some little movement in the lumbar spine, but there's no forward bending. So you keep that protecting lordosis. Michelle, let's jump to present moment. How are you doing now?
So now I'm doing really well. I would say in the last 2 months, I've got a lot of strength back, a lot more mobility. I was able to work with the physiotherapist to kind of really slowly ease back into movement, first with the pelvis and then with more of the body. And in this last week, I've been able to start the yoga practice again, to start swimming again, obviously cautiously with all of it, but most things in life I can enjoy and be involved in again.
Now let's have a look at the underlying mechanism. How did this happen? So there are two aspects, the physical and the psychological. The physical one, in your case, what I found is there's too much movement in the lumbar area and not enough movement on the thoracic spine and in the hip. So the strategy was to have more hip extension and more rib flexibility and rotation in order to stabilize and protect the lumbar spine. So you understood that and integrate that? So how does this feel, in terms of now everyday life, in terms of yoga? Is it different from how it felt before, how you use your body? Or let me know more about that.
Yeah, I've actually found that really interesting to explore. I have an interest in movement, I would say anyway, but just learning what my habitual patterns are, having that awareness of noticing when I'm going back there and making slight adjustments has been great. I think it's helped build my interoceptive awareness, also my awareness of what's happening in my own body, which I think is a thing that's supportive of my overall well-being. So I've actually enjoyed that process of learning the underlying causes and also learning how I can adapt that in my everyday life, not with anything complicated, but just small adjustments.
And the other aspect is, your life, your workspace, your work, and in a situation like this, it really slows you down, so you breaks your speed. So how did you get out of that?
I think that was the other very interesting aspect of it that, in hindsight, I can see is a benefit of taking a more conservative route. I had taken active steps to slow down my life and remove some stress and work differently over the last few years, but this even took it to another level. And I think that's been really helpful as well. It's allowed me to just build in more space for regeneration, more space for just being. I don't think I've ever had a time in my life where I've lied down so much. So now that I'm picking things back up again, I'm making sure I have space for that. And I think it leads me to feel healthier and more integrated overall.
Yeah, in my 30 years as a medical doctor, I saw hundreds of people with herniated disc, conservative treatment. And the win on this human level is especially somebody who really is a high performer like you are. You move from efficiency to effectiveness, but it needs that moment of metacognition, where you really watch what you're doing and how can I do it more effective, not more efficient. Efficient means you squeeze in everything in time, and effective means you do the right thing at the right moment.
It's a nice way to describe it.
So my congratulations and wishing you all the best, for your career, for your work. I think your great work you're doing. Thank you very much for being here.
Thanks for your support.
Herniated disc, as we saw quite often, the key message is they have natural history, is quite beneficial. They heal themselves in many cases. And what we can do in terms of finding the reasons, underlying movement patterns, underlying lifestyle patterns, to change, to address them and to change it. And then you come out of this crisis, in a more complete and stronger and healthier way. Thank you very much for your attention.